Is your periodontal procedure average above 20%? If so, congratulations, you're doing better than our industry's average. Over the last 7 years, across the United States, our industry as a whole isn't doing more than 19% for periodontal procedures. Kind of crazy, right? Especially when back in 2012, the CDC did a pretty huge study that I think most of us are familiar with. In it, they stated that by age 30, of the population already had periodontal disease. So, why today do you think there's still such a huge gap? Well, I'm sure there's several facets to this mystery, but I think I have a pretty big idea about one of them, and it has to do with the language we use in our hygiene operatories. I'm going to share with you a story that I think parallels nicely to a routine hygiene visit turning into a periodontal disease diagnosis, and spoiler alert, it's probably not the kind of story you're going to expect. So a few weeks ago, I had an appointment to get an oil change. And truth be told, I was kind of dreading it. As much as I really like our long-term mechanic, John, he's been known to have some extras, and I never really know if I need them. But regardless, a car can only go so long without an oil change, so I had to get in there. This particular day, I was in a bit of a rush. I had several meetings stacked pretty close together, so I was really hoping to get in, get out, nothing extra. So as soon as I pull in, I let John know that all I needed was an oil change, and I was in a bit of a rush. He says, "No problem, Tasha," and gets my car right back. I take a seat, and I start checking email on my phone. What feels like moments later, I look up to see John is already walking towards me. And I'm thinking, how in the world can my car already have a problem? He literally just got it back there. But I do my best to pay attention. He starts talking and describing to me about different materials, synthetic versus regular, some kind of a flush that I should consider, something else is wearing thin. Like, I don't even know if I need these things. Maybe they're just an upsell. Then I hear him say something about a serpent, and I knew I had to do something quick. So I stopped him in his track. And I said, "John, thank you so much for this information. And I really do appreciate it, and I will take it under consideration. But today, can we just do what we did last time?" He gives me kind of a funny look. I'm pretty sure it was a dirty look. He says okay, but before he turns and walks away, he looks at me right in the eyes and he says, "You know, Tasha, you can't put this off forever. It's not safe." Well, maybe I should have gone through with what he was recommending, but ultimately, I just wasn't ready to move forward with something that I didn't understand. Let's contrast this to a routine hygiene visit that turns into a periodontal disease diagnosis. And perhaps some of our patients are like me when I was getting my oil change, and they're thinking, "Please, Lord, let me get in and out of here without any extras." Well, I sure hope not. But if I'm being honest, they probably do. But I don't think it's because they don't care what we have to say. I think it more has to do with they don't understand what the problem truly is because of the language we use. So our efforts to educate our patients on bleeding points, pocket depths, swollen margins, the amount of calculus, all gets lost in a language barrier. And sadly, that conversation generally comes long before our opportunity to explain to our patient how an unhealthy mouth directly and negatively affects the rest of our body. Let me give you an example of this language barrier. So Tom Brady says he speaks 2 languages, English and football. So if Tom were to explain the rules of football to somebody completely unfamiliar with the sport, how much would make sense? Maybe not much, right? Well, I think we're the same in dentistry, except for we speak English in dentistry. So for us to explain a problem to our patient, we generally first try to teach them our language, which brings me to the second problem. They don't really want to learn it. They just want their teeth cleaned. So what do? Well, I propose we stop speaking dentistry and adopt the same language their physician already uses with them. I feel we need to snap our patients out of the autopilot of a routine hygiene visit and really jump into healthcare where we truly belong. So a routine visit that turns into a periodontal disease diagnosis using language that our patients are more familiar with would probably go something like this. "Mrs. Smith, I'm really concerned about the changes I'm seeing in your gums today. You have a lot of inflammation, redness, and even bleeding. This definitely appears to be a gum infection caused by bacteria." Mrs. Smith's ears may have perked up by the words change and infection, and she may say something like, "Infection? How in the world would I get an infection?" That's a great question, and we don't always know. But what we do now understand is that gum infections are primarily caused by bacteria. And like other bacterial infections, we just come in contact with them. Think of these bacteria like termites in the foundation of a house. They burrow deep down. They live inside the gum tissue and on top of it, which is why great home care can't always get rid of them. And these bacteria can cause a lot of inflammation in our gum tissue. And that makes our gum tissue leaky and permeable, which means the bugs swimming in our mouth can be swimming in the rest of our body. Wow, this sounds serious. I'm surprised I haven't noticed anything at home. I know, this is a surprise, and a change from your previous appointments. Infections like these rarely hurt. It's kind of like high blood pressure or cardiovascular disease. It doesn't hurt until it's quite advanced. The good news is when we catch it early, these infections can be easy to treat. Well, what do we need to do? I'm glad you asked. Think of the cleanings we've been doing like a routine car wash. What you need is the full detail, really spending time getting in the nooks and crannies, places we just can't reach with a traditional cleaning. And there's some homework on your end. So when can we get started? Simple as that, right? So as you heard, I didn't mention pocket depths, bleeding points, swollen margins, or the amount of calculus. But that's not to say those terms aren't important, because they are, especially if you're filing dental insurance. But to our patients, these terms are a different language, and one that doesn't necessarily sound like infections. Ultimately, if our patients don't understand what the problem is, they're more likely to do what I did at my oil change and just say, can we just do what we did last time? And that makes our job as healthcare providers so much more difficult and dangerous. So if my mechanic, John, would have led with, Tasha, your car's serpentine belt ensures your car starts, runs, and gets you to your important meeting. I'm afraid if you wait much longer, you're going to be stranded. You can bet I'd have made time real quick to get that belt changed. Thank you.